This meeting has begun.
Good afternoon and welcome to the final webinar of this three-part series on the CLAS standards. Our audio today is through the conference line, so we ask that you please mute your lines to ensure that everyone can hear the presenter clearly and without any interruptions. Please make use of the chat box to submit your questions or comments and feel free to do so at any time. This will be the most interactive of the three webinars. There will be a video clip that everyone will need to manually click to enable. There will also be several poll questions throughout the webinar to assist in collecting your valuable input, which will be used to dictate the content that will be presented at our annual health conference, The Power of Rural, which takes place May 16th through the 17th in Casper, Wyoming. We will send out the final evaluation for today's webinar out tomorrow. WYPCA would really appreciate it if you could fill it out. So we're back with our CLAS expert, Alicia Gonzalez from the National Center for Farm Worker Health. Without any further delay, I'll let Alicia get started with her fantastic content.
Thank you. Can you hear me okay? Okay, at any point if you cannot hear me, just let me know and I will get closer to the phone here. Welcome everyone again. As Hannah just mentioned, we are on the last of the three-part series, and thank you all for being part of the last one here today. I recognize a few of you who have been on over the last couple of webinars that we've had. And so we'll go ahead and get started because this is the section that has quite a few of the standards, and I want to make sure that we have some time to go through all of them during this next hour. But for those of you who may not have been here on the last two webinars, this is a series. You can see here on my slide what we've done in each of the webinar parts. We started with the role of governance, leadership, and workforce. Then we looked into some specific strategies around communication and language assistance. And now we're wrapping up with how do we continue to be engaged long-term, not only internally and in our system, but how do we engage others that are outside of our healthcare system? So how do we engage stakeholders and other community partners? How are we continuously improving upon some of the goals that we set forth? And then how do we, as an organization, maintain some accountability through all of the practices that we implement on a daily basis? So this is pretty much bringing it all together, and you know, I know there's been so many standards, and so again, this now looks at how do we make sure that all the standards that came before the ones that we talk about today, how do we ensure that they continue to be integrated through all of our systems? So let's get going here on the last theme, theme 3. And so as we think about these issues around this theme, engagement, improvement, and accountability, these are some kind of questions or kind of things to think about as we go through the last set of the standards. Identifying champions. I did talk about this on the first webinar when we talk about leadership and governance. This is where you're going to start seeing some overlap. And so the first theme was around, well, have we integrated at the leadership, or have we made a commitment at the leadership level and at the board level that we're going to integrate CLAS at all parts of our organization, okay? And so likewise, as I mentioned in that first theme, I said we should have some champions that are rallying for this, and we should think about having a committee. Likewise here, you think about the same committee that you form to look at practices. You want to make sure that this committee is also going to be looking at ways to continuously improve upon the practices and making sure it's infiltrated throughout the organization. Conducting those organizational assessments. We talked about that earlier on in the other theme. You know, are you thinking about assessing all of these practices? Here now, you really want to look at, now what do I do with this data? Okay, how are we using it? Are we just conducting assessments just for the sake of conducting assessments, but are we actually changing our practices? This is part of this theme. How do we integrate it in terms of our strategic planning? Again, the first theme, we talked about strategic planning as being the infrastructure for doing this, but here's about setting those benchmarks. And are we looking at how we're doing, and if we're not doing as well as we anticipated, how do we tweak some of those strategies? Do we have sufficient fiscal and human resources to support all the efforts? And how are we involving community and patients in monitoring our progress? So these are kind of the big global themes. Again, I encourage you to pull out some of the cheat sheets that I've shared with you. I have that one sheet that it's a template where I have some key concepts and words for you with examples of strategies. I encourage you to have that out as well, because there's going to be a little bit of a different information that's different from what's on the slides rather. Okay, so let's start with the first standard under this theme, which is all about establishing those goals and policies and accountability. And here, really important, how are they being infused throughout the organization's planning and operations? So if you already have an existing strategic plan, perhaps you pull it out and you look at it and see how are you integrating CLAS, or culturally and linguistically appropriate service standards. I'm sure, just being in health centers for so many years, I see a lot of these things that we've talked about play out in the strategic plan. That's great, as long as you have it in your strategic plan. But I've also seen health centers where they have a whole goal or a direction, a strategic direction dedicated to initiatives like CLAS. Okay, so again, it's pulling out those strategic plans. Here, it's really about looking at those mission and value statements that you may have, let me go back. Looking at those value and mission statements, to what degree do you demonstrate or you verbalize to all of your partners and your community members that this is a really big part of your system. So as we think about some of these policies, or we think about some of these really important considerations that we need to be really integrating into our systems, I want to show this video clip, because I think this video clip really illustrates how we should be thinking about our policies and making them work for our community. So this clip that I'm going to show you again, it's really about, it's on YouTube, and this is about language access, though. How do we break down the barriers by looking at an issue? We're looking at the issue, and we're going to actually put it into practice. So if you will, I'm going to click on it now, and if you can just please follow the link so that you're able to listen to it on your end. And again, it's like a 2-minute clip.
Can I help you? Do you speak English? English?
English?
No,
English.
Do you have anyone with you who could translate for you? This patient is in pain. He hardly speaks English, and I can't even get a basic medical history from him. Yeah, I have you.
Well, there's Boom and computer English. Speak an Asian language, but I'm not sure which one. Why don't I make you introduce you with Doctor?
Okay, perfect.
A patient here, an Asian language, but we're not sure which one. What language do you speak?
I speak Thai.
Can you ask him what language he speaks and what his name is? Hello? What's that to be now? What?
สวัสดีค่ะคุณชื่ออะไรคะ
Look like to you, sir. They're gonna look and bow him.
I couldn't figure it out how to do it any other way. She left for the day.
Now let's see what happens when competent language assistance is provided.
Can I help you? Do you speak English? English?
English? No.
letters, I put it down here. Hi, Lynn. Thanks for getting here so quickly. This is the patient.
Xin chào, tên tôi là Liên Nguyễn và tôi là người thông tin của ông để giúp ông và bác sĩ nói chuyện với nhau. Trách nhiệm của tôi là để bảo vệ thông tin chính táo của ông và thông tin chính xác những lời nói giữa ông và bác sĩ. Nếu ông có thắc mắc nào thì xin ông có tự tiện hỏi.
Okay, hopefully you all were able to follow along with that clip. And I wanted to show this one in particular because it was about language competency and assistance in that area. And I know that's something that is a challenge in healthcare settings. And so I really like how they use something very simple to help a patient be able to let the healthcare provider know what language they needed. And so this is, again, a shorter clip of a larger training program. If any of you are interested in finding out more details about it, please send me an email. But I like to show this because it's one of the biggest challenges, as I just mentioned, and it just shows how you can integrate simple things like the use of here this language card so that the patient's able to identify, tell you what language they need, and then they call on the right interpreter. So this is a really good example of this strategy 9 or standard 9 that looks at a particular practice around some of these issues. So let's go forward. Here are some examples of some strategies. We saw one in particular around language access. Here, these strategies have to do more, they're kind of more bigger, looking at goals. So developing those plans with measurable goals. So if you're not using SMART objectives, this is the time when you want to use those. Establishing accountability mechanisms throughout the organization. So thinking about perhaps how do you generate, reports, or how do you use surveys, or how do you use focus group results as a way to help you be able to set appropriate goals. So there's just some examples here of how you establish some of those policies. Others, if we look at the cheat sheet that I provided to you, here, if you don't have a mission and value statement, making a commitment, that would be a really a good way of infusing that culture within the health center. Creating those committees and plans. To what extent do you hold staff diversity events and celebrating and honoring difference? That is a way that you can infuse some of these cultural issues that we've discussed into the system. Okay, so if you had to think about some key concepts here, it's really about your mission, vision, and collaboration throughout the organization. Okay, so I'm gonna stop here and ask a question. Here's our first poll question. I'm just curious to find out if your organization, or does your organization have a CLAS plan that is implemented throughout the organization with goal targets? So if you can take a minute or so to answer this question, and if you're not sure, that's fine. There's an option for that. Okay, so I want to know if you have a plan and that it's actually implemented throughout the organization with goal targets.
Zero for class, right?
And we'll give you a minute or so to respond. I know there's quite a few of you on the line today, so we'll wait till everyone's had a chance to respond.
I should just find that one right there.
And I believe someone has their line open and not muted. I'm hearing some background noise. I'm not sure if everyone has their phone muted. Okay, we have, I'll give it another minute or so. I got about three responses to the poll. If you wouldn't mind answering that. Okay, we just closed the poll, and of those of you who did respond, I'm not sure if you're able to see, the results. I do, but we only had 4 respondents here to the poll, and 2 of you were not sure, and the other 2, one said yes and one said no. So it's just a good time to think and perhaps go back to others in your organization and find out if this is part of the planning, and if it's not, how can you start integrating this into either your current strategic plan, or even as simple as putting together a committee. Perhaps you have a quality improvement or a quality assurance committee already in place that may already be looking at some of these issues, or perhaps that would be a good committee to look at some of these CLAS standards that we're mentioning here today. So thank you for those of you who participated. So let's look at the next standard, which is number 10, and this has to do around assessment. So again, this goes into the accountability. We talked about this whole theme around assessment and accountability and improvement. So do you conduct assessments of your CLAS-related activities, and are you integrating CLAS-related measures into quality improvement? Again, if you have the strategic plan and you have goals and targets, you should also have a way to assess if it's actually working, okay? So here it's about continuous improvement and doing regular self-assessment. So when I think about some strategies in this section, not only in the organization, how are we doing as an organization in looking at all these things, but it's also about, I think of staff performance evaluations as well. If this is infiltrated throughout the organization, are we assessing our staff performance as it relates to these goals? If it's part of our mission and our value statement, how do we ensure that all staff are carrying out what our mission states? So that's another thing to think about there. All the community surveys that you do in your communities and with other partners, are you able to collect, or are you conducting assessments that you're looking at ways to continuously improve your service delivery as it relates to these issues that we're talking about? Perhaps you hire an outside consultant. Another strategy that I've seen is health centers hire an outside consultant to facilitate this type of planning or ways to improve your organization. So these are just some examples here. I talked about focus groups. How do we use those to monitor progress? Adding class-related questions to staff orientation materials and yearly reviews. So that's part of the recruitment that we talked about in the first theme as well. Okay. So here I'm going to ask you another question. So another poll question I'd like you to take some time to answer. So does your organization assess its efforts to meet CLAS standards? So we talked about staff performance evaluations, we talked about community surveys, focus groups. So does your organization have or integrate any of those things to meet CLAS? The poll is open, and if you would take some time to answer that. Again, if you're not sure, that is okay. And I know pretty much in all the healthcare organizations I've been in, I know for the most part, they always do some sort of patient satisfaction, where they ask the patient if they feel that their provider was speaking to them in their language, or was being able to understand, where they were coming from, or understand their cultural beliefs. So if you have any of those types of questions, that would be meeting this standard. You're assessing those practices. Okay, so for the majority of those so far who have answered, well, let me give it another minute here. Okay. So for those of you who answered, again, pretty much half and half. Some of you said yes, some of you said no, and one person said you weren't sure. And so this would be also a really a good strategy that you could implement right away is if you're not assessing your practice through these types of surveys, or even if there were annual patient satisfaction surveys, I would really encourage you to do that if you don't have that in place. Okay, let's keep moving here. Now we're going into standard 11, which is, again, how do we collect it? So prior was, are we assessing it? But then this is about collecting and maintaining accurate and reliable demographic data. So this is about demographic data to monitor and evaluate the impact of health, of equity and outcomes. And so again, this is where it gets kind of tricky. They're starting to sound alike, but the previous standard, number 10, was doing these general assessments on looking at your quality improvement and ways you can improve your services. This is really specific to demographic data. I know all of you who are from health centers collect demographic data. You have to currently collect it now for your UDS. So as long as we're consistent in doing that, because we want to use that data, race, ethnicity, language data, of course, this is all about language access, to be able to provide the interpreter services that your populations need. We want to ensure that we understand who are the ages of our patients, where do they come from, you know, understanding a lot of those cultural characteristics that we talked about during the first webinar becomes very helpful. That's the rich data that I hope that you're collecting and that you're using. I know for a lot of outreach staff, they use that or they bring that information back to the health center because it's important that they understand. It's important that everyone understands, you know, the nature of the communities that you're serving, the language impacts access to care, their immigration status impacts, poverty impacts. So to what degree are we collecting and really maintaining and understanding a lot of this demographic data? Okay, so this is all about demographic data. Here are some strategies. Are you using multiple opportunities to collect the data? So patient registration collects some, and then as they go through the different points of interaction, there's opportunities to collect other type of data, and to what extent do we integrate that into our practice management systems? Are we training all staff on the purpose and importance of collecting the data? And more importantly, a strategy is explaining to the clients how it will be used. And I think about working specifically with migrant health centers or health centers that receive agricultural worker dollars to see those patients. And sometimes we say, we want to know if you're an ag worker or not, or we want to know if you're homeless, and we want to know, all these special populations. But it's helpful if we explain to them why that data is important, okay? Because it also kind of eliminates that barrier that is there, especially right now in the current climate that we're in. This becomes critically important. And as part of training of our employees, do we provide them with the script? Because this can be a little challenging. How do I inquire about all of these kinds of sensitive topics without maybe offending anyone or not explaining why I need it? So to the extent that we can provide a script to our staff becomes an important step. And here, of course, we talked about this in the previous webinars of why the language access and data is so important. And all these come from the Office of Civil Rights data guidelines. So I just wanted to share that with you. And there's a link there that you can access later of why it's important that we collect the data that we need to collect. So if we look at standard 12, I'm going to move on to 12. This is conducting, again, more assessment of community health assets. Earlier I was talking about assessments, looking at ongoing improvement. That had to do more with internal. So to what extent do we evaluate staff, and are we doing some of those patient satisfaction surveys? This is what do we know what's going on in our community so that we're able to plan the right services? Okay, so now we're shifting to community surveys and community assessments. Yes, earlier I mentioned focus groups, and I was mentioning focus groups as a strategy to conduct focus groups with current patients. But here, this is an opportunity to perhaps do focus groups with potential patients of your health center or your organization, because you want to make sure you understand what some of those barriers are and what some needs are. And this becomes really important because as your populations change, our communities change pretty rapidly, and we want to make sure that we're on it, that we're making sure that we're being responsive. So here are some strategies. Do you partner? Are you partnering with other organizations to negotiate data sharing? So perhaps through some MOUs that you might have in place, or MOAs or contracts with other organizations, you're able to kind of share and looking at some of that data. Collaborating with other organizations and stakeholders, looking at reliability and validity. If you wanted to do more kind of research, a lot of health centers have partnerships with universities to be able to look at research to a particular population. Reviewing demographic data collected with the local health and healthcare organizations. So I'm going to stop here and ask another question. I want to know a little bit about what you're currently doing to assess your community health needs. So here's your question. Does your organization currently conduct any of the following to assess community health needs? So there's plenty of options here. Are you doing focus groups with your existing or potential patients? Are you doing key informant interviews, patient satisfaction surveys, needs assessments, or you do not implement any of those strategies? Or if you're not sure, that's a valid answer as well. Okay. Okay. All right. Okay, looks like we can close that poll down. Thank you so much for your responses. It looks like the majority of you at 80% are conducting patient satisfaction surveys, so that's great, and also needs assessments. I figured that would be the case because for those of you who are applying for grants, or if you're getting HRSA grants now, part of your application process is to be able to understand the needs of your community. So very good. I figured that would be the case. Again, always a good strategy at all times to be able to get additional information is through the use of those focus groups as well. I highly encourage you to do those, or if you have outreach workers or promotoras de salud, they would be a really good good staff to be able to do those. All right, so let's keep moving further. Now we're on Standard 13. And Standard 13 has to do with, the key concept here is all about community partnerships. So do you have community partners to design, implement, and evaluate policies, practices, and services? So here's a good example of maybe having a unique partnership with your local university, okay, to be able to look at this, look at all of these things that you're doing. So here's some strategies: partnering with local media to promote better understanding of available care and services, building coalitions with community partners to increase reach. There are so many local coalitions that have different goals. Perhaps not only building your own, but partnering with other coalitions, sponsoring or participating in health fairs, cultural festivals and celebrations, offering education and training opportunities or strategies here, convening town hall meetings, collaborating to serve more people, to share information and learn and improve services, work with partners to advertise job openings. So here you look at of all the previous standards, how can we work with and collaborate with our partners to be able to, do all the things we have to do. So I go back to job openings. We talked about that in the first theme of the CLAS standards. That had to do with recruitment and retention. So how do we engage our partners to be able to recruit people from the communities that we're serving? Let's see. Let me go back here. And then, of course, adoption of promotoras who serve as the liaisons or links from your healthcare organization to the community. Okay? So let's move to standard 14. We have 15 total, so we're on the last two here. Now we're going to shift a little bit about how do we handle conflict and grievance in our organization, and do we have processes in place? But they have to be processes that are culturally and linguistically appropriate, okay? And so it's just, what do we do? How do we identify that we may have an issue, prevent, and resolve those conflicts? So again, the key words here is preparing a culturally competent grievance process, okay? And so I know that a lot of organizations have conflict resolution, but the question is does it take into account different language and cultures as well? So here are some strategies. If you do have a process in place, are we providing staff with cross-cultural conflict resolution if to be mediators? Okay, do we have a policy, grievance resolution in the Patient Bill of Rights? Provide notice of complaint policies in clients' languages. So do they know how they can submit a complaint? And again, is it culturally and linguistically appropriate? Are we including questions related to understanding the grievance process in your patient satisfaction surveys? So those of you who said yes, you're doing patient satisfaction, you would be meeting this standard if you ask a question around, if they had an issue, where would they go? And if they have they felt like it was handled in the right way? Okay. How do we promote diversity? Through our policies and, of course, our practices. This goes back to the first theme and also the current theme that we're talking about. If we have a plan and it's being infiltrated throughout the organization, then you would be meeting that standard because you're promoting those policies. Okay. How do we respond? Are we responding to the complaints? How are we doing that? What's the process that you currently have to respond to complaints? And what is your strategy for resolving cross-cultural conflicts? Those should be in your policies. Okay? So the last standard I want to review with you is communicating. Now this is how do we ensure that our stakeholders, our constituents, and the general public know that, hey, we're committed to CLAS, we're implementing these goals, and we're sustaining it. So what do we do publicly to convey this information, okay? And how do we build and sustain that communication between the community and the service setting? How do we share information about your organization's cultural competence with the public? So some of the things to think about here, what methods do you alert the public? Do you have this information on your websites? I'm sure that, on your websites you have your mission statements and your vision statements, and you say who you're reaching, and we're wanting to reach everyone in our community. And so to what extent do you share progress also on your website about all the wonderful things that you're doing? You're doing health fairs, you have mobile vans, mobile clinics. All that is a demonstration that you are moving CLAS forward. You are being responsive to the needs of your community. Okay? And again, so how do you share it and how do you do it on an ongoing basis? So if we look at some of these specific strategies here, one way to do that, when you go do presentations at a conference, for example, you're sharing kind of what's going on in your communities, and you're sharing demographic data is so important. It paints a picture of who are some of our vulnerable populations that we're really trying to increase access to how do we, even reporting this back to the folks, our organizations who are giving us grant money. I mean, we need to let them know what we're doing with our grant dollars, okay? How are we leading discussions in the community around access? How do we inform everyone in the community that, hey, my health center or my healthcare organization, this is our mission to do X, and we want to serve, we want to serve the community. So it's all about being very proud of all of the great things that you're doing to improve access, okay? So with that, I'm going to stop here. Well, first I'll stop, before I go to this poll question, does anyone have any, and I want you to use your chat feature if you can, does anyone have any thoughts or any questions around this theme of accountability and engagement? I'll wait for some comments. We see a poll that's going up, okay? So if you have any specific questions around theme 3, I'd love to hear them on the chat. But now that we've gone through all the themes, this poll question is about, of all of those that have been presented, which one do you feel your organization has a handle on and you feel, you know what, we do a pretty good job in this area? We talked about what happens at the top, and then we talked about communication and language assistance and the use of interpreters and having the right health information written in the right language, and then we just talked about sharing the good work that we're doing and continuously improving upon it. So if you had to right now just think off the top of your head what you feel you're doing really well, I'd love to hear it. So if you can take a minute or so to respond to that poll, and I'll take some of your comments as well on the chat. I'll take those also. And again, if you're not sure, that's a valid answer as well. Okay. Let's see, I've had one respondent to the poll. Okay. Okay, I have about half of you that already responded. Thank you. So it looks like the majority of you felt like you have a good handle on theme 2, which is around communication and language assistance. And I'm very happy to hear that because that is one of the most important factors in terms of delivering health care. And so you want your patients to understand what you're sharing with them. It's very important, but I also know it can be very challenging, especially for areas that are very remote and very rural. That becomes a real challenge because there's a lack of resources. So I'm happy to see that you all have a really good handle on that. Okay, let's move on to the next slide here. Another question I have for you. So likewise, with all these themes that we presented, which one do you feel your organization can use further assistance in achieving the standard? So you have a good handle on communication and language assistance. Where would you like to see further improvement? And as you think about this question, think about your role in your organization and think about, well, how long has it been since we've talked about this? How long has it been since we've done training around cultural competency? How long has it been that we've done strategic planning and really thought about this area? When's the last time we discussed, health literacy. So as you think about this question, think about some of those things that we've talked about. You know, have we changed some of our policies and procedures? Did we just go through a mission revamp in our organization? So if you could spend, let's see, just a couple of you have responded. Okay. So half of you so far are not sure, and then one said theme 3 and one said theme 1. And so, and for those of you who did not answer, I really encourage you to, again, to go back and find out, you know, what are those areas that we could definitely improve upon. And one of the first, and I'll refer back to the implementation plan that I provided to everyone on the first webinar. It's a template, and I encourage you to use that. If there was anything specific around, say, theme 1 that you feel like you can improve upon, that would be one of the goals or the activities that you'd like to implement in your organization. So I just wanted to remind you that you have that tool to start building some sort of an action plan or an implementation plan. Okay, did anyone have any thoughts or questions? This is our last webinar. I do have a couple of more polls that we're going to go through here in a little bit that's going to help us plan for the May conference. But before I go there, if anyone would like to share a comment, a general comment about anything that was presented today, or even in the last 2 webinars, I want to make sure we have an opportunity to address those.
Alicia, since everybody is able to ask questions over the conference line, would you like them to do so, or would you like them to use the chat box?
Well, I mean, whatever folks are comfortable with. I don't know what the sound would be like, the sound quality. We can open it up. Whatever
Okay.
you think.
So whichever you would prefer. If you would like to submit your question through the chat box, please feel free to do so. But if you do have a question, please feel free to unmute your line, ask your question, but then we ask that you please mute it again. Thank you.
I know that this is a lot of information to grasp, but this last theme, I just feel like we could. And of course, I didn't write the standards, but I feel like there's a lot of overlap, and which makes it feel more. There's a lot more tasks to do. I think we could probably narrow all of these standards really to, like, half of them. But if there's just any point of confusion, I just want to make sure that we have a chance to talk about it. Okay. So let's move on, since there are no questions or comments. I want to ask a little bit about planning for the upcoming conference. And the reason I want to spend some time doing this is because we do have a session planned around CLAS, but I really want to make it something that you really need, as opposed to me deciding what the content should be. But I'm curious, first question is, for those of you on the phone, do you plan to attend the Power of Rule conference that's going to be held in Casper, Wyoming on May 16th through 17th? So that's the first question. So if you can answer, and if I can get everyone to respond to this one, that would be great, because this is very important for us for planning purposes. And for those of you who do not plan to be there, I was happy to see that you participated in this three-part, and just know, you know, we're your PCA there, and as well as I can be a resource for you following this webinar. So I have 3 respondents. We'll give it another minute. Okay, it looks like we only had a few respondents here, and I have only one person who's actually attending the conference. So I'll put up the next question, and so even if for right now you're not sure if you're going to be there, but if you think you might be there, or yet you still haven't decided if you're going to be there yet or not, if you can still answer this next question. If you do attend at the last minute, would you plan to participate in the class session, which is going to be held on the 17th from 8 to 11? So even if you're not sure yet if you're going to attend, if you would just respond that, you know, if you were to go, would you attend the class session? Okay. All right. So yes. And then let's go to the next poll. The last poll I wanted, and even if, so while I'm asking about this in terms of attending the conference, and if it's not the conference, say we decide to host another webinar in the future. Given all of the information on CLAS, oh, and I apologize for we reversed the order of class there. Given all the information on the CLAS standards that have been presented, what specific training topic would you like to further learn about? Again, even if you don't come to the May conference and we host a webinar later, what do you feel? Because we talked about all the standards, right? So we were talking about big picture. But if you think about areas that you think your health center might need or your organization might need to improve on, what training would you need? Is it cultural competency skills? Is it health literacy skills? Is it about how to write health information and messages in a format or in a literacy level that your patients will understand? Is it more information on general class, or is it another topic? And if it's another topic, I would like you to put it in the chat box. Because this is such a, as I mentioned on the first webinar, this is one of my favorite areas to talk about, because I really think it sets the foundation for all of the work that you do in healthcare delivery, and it's so much, and it's so big to tackle, right? And as we think about staff development for, you know, throughout the year, for all of our staff, we really need to think about what are the most important skills that we need to be really looking at more consistently than perhaps than we haven't in the past. And so here, for those of you who have responded, the majority of you are saying health literacy skills. Okay, so we do quite a bit of training on health literacy skills, where we look at how do we start observing. How do we observe if we have people with limited literacy? How do we assess that? What are some practices to integrate? And then, of course, how do we communicate the messages in the right way? Because, you know, in a health center or a health setting, we tend to use acronyms and a lot of jargon that perhaps our patients don't understand. So we really go through a skill building opportunity where you actually practice how to do some of those cross-cultural interactions. So it looks like the majority of you would like additional information on health literacy skills and how to write health information and messages. Very good. Thank you. Thank you so much for those comments. And as we went through the polls, I kind of took notes on where the areas that you felt you needed improvement on, or those areas that you felt that you're doing a really good job on. So that was very helpful, because then we can really think about how we put the agenda together for future training for you guys. So that is all I have. We're about 9 minutes shy from ending the webinar. If there are any comments, we still have some time to take any comments. And I know some of you on the call today are not from Wyoming, so it might be difficult for you to travel there. So I appreciate the comment, and again, feel free to reach out to us if there's something in particular that you might want to get more information on. And as a service, just so you know, on a side note, we here at the National Center for Farm Worker Health, we provide a lot of this workforce development training. Not only do we provide CLAS standard training, but we do training around all of these issues that I put up here, because those are really critical, as well as customer service and communication skills. So all that becomes part of these, you know, part of that ongoing workforce development training that we were talking about now. So I thank you so much for being here for the last 3 webinars. I hope that you have found it helpful, and that through the use of these tools and the key concepts, you have a better understanding of all these standards. But I hope you, more importantly, walk away feeling good about the work that you're doing, because as I said on the first webinar, there's no doubt that you're not doing this stuff. I know that you do it pretty much every day in your practices, but it's nice to take a step back and look at the full picture and look at, I mean, there's always opportunity to grow and to improve. And so the purpose is that we look at all of this together and identify those areas where perhaps we need to improve upon, and how do we do that. And so there are so many resources that I can connect you with that are out there. Again, our communication doesn't stop today. If you think of something that you might have an interest in, feel free to reach out to you know, Hannah at the PCA or me. You can send me an email, and I'd be happy to share that with you. So thank you. I have nothing else, Hannah. I don't know if you wanted to say, have a question or a comment or a thought.
Oh, sure. Well, thank you so much, Alicia. This has been tremendously valuable to us. We will be sending out the recording, and it will be available on our website on the resources page under webinars. We will be sending out an evaluation, and we do have a space in there to submit additional questions if you feel more comfortable submitting them that way, and we'll be sure to get them to Alicia. So with that, thank you everybody for your time. This has been a great experience for us on our end, and have a great rest of your week.
Thank you.